And I went to see him. And then he said that it was the mesolid that had given me the hepatitis and that I was lucky to be alive.
What was your reaction to that?
Total shock. I suppose I was in such a state of shock that I couldn't question anything. I couldn't question further. I just left. And I suppose that poor woman died.
And after that, how did you feel about it?
Sorry. Just shocked. For 6 months I was taking that drug and I didn't know that it was slowly poisoning me. I didn't know that. We were the guinea pigs, that's how I feel. It was like a live drug trial. I mean, if people died in '99, that was 6 years before I took the drug. How many more people were sick? How many people were reported sick? And when there's other drugs that could be taken in place of it, that's what I don't understand. It's not like it was the only drug that I could take. I wasn't given a choice.
In part 2, we learn more about the weaknesses of our drug safety monitoring system and ask if the Olin story could happen again. In the years after the alarm was clearly sounded about Olin and some hospitals were discouraging its use, other patients began taking it without knowing about the risks. Marcia O'Hagan's mother, Sheila Gunn, was taking Olin for roughly 9 weeks when she began to feel ill, but it was only when Marcia brought her to hospital that medical staff suspected she was suffering a toxic reaction to Olin. When Marcia arrived to see her a few days later, she got a shock.
When she actually turned in the pillow, her face was all swollen on one side and she was so yellow that it was like coming out of her eyes. Her eyes were watery and she was really, really yellow and she was finding it hard to breathe. And I set her up in the bed and I gave her a little drink of water and she actually got sick. And then the doctor came and I said to him, my mum's not well. And she just kept saying, I find it very hard to breathe. And she was just saying, I've an awful pain here.
Sheila's liver failed and she died before there was time to consider a transplant. Her daughter found it hard to accept that it was the drug that had killed her mother, particularly as she herself suffers from arthritis and was also taking the drug.
I was on Olin at the time and I was saying there's a possibility it could be this drug that I said is used so widely and everybody in the country is nearly on this. No, we couldn't believe it was that drug. Because so many people, there's 40,000 people in Ireland with rheumatoid and osteoarthritis alone, and that's their starter drug, and they're not monitored. So it couldn't be that, because it had to be safe. You couldn't put that many people in the country on a drug that's not safe. So I rang up the medicine board and I just told them that my mum had died on Olin, possible Olin in the hospital, and I said, I know it sounds a bit far-fetched, I just want you to know. And they said, well, usually the hospital where you would die would actually report this, or maybe whoever prescribed the drug would report this. So, like, more or less, well, thanks for telling us, but, like, they will be doing it. So I thought, that's grand, they'll be doing their job, they'll report it.
At Sheila Gunn's inquest earlier this year, where her death was found to be an adverse reaction to Olin, it emerged that no medical person reported her case to the Irish Medicines Board. Had it been reported, it would have been the 4th suspected case by 2005, a year before Dungarvan woman Joan Flavin also had a fatal adverse reaction to it. Marcia wonders whether the reporting of her mother's case could have led to the drug being withdrawn earlier.
My mum had died in December and that lady hadn't even...
Telling him they had 6 suspected deaths, later corrected to 5, linked to the drug. At the time, no action was being considered.
It raises the question of what is the tipping point in relation to any particular medicine, and one has to figure out at what time does one say, well, so many fatalities is enough? At what stage is the benefits outweighed by the risks? And in my view, in a relatively small country, to have 5 or 6 people suffer fatal doses of a particular medicine will give rise, to any normal person, to serious concern.
The following month, after the IMB was asked to appear before Joan Flavin's inquest, they suspended the drug. They say by then the circumstances had changed. They had just got a report of 4 more liver failures going back over some years from the National Liver Transplant Unit. It appears this was the tipping point, and the previous suspected deaths in isolation were not enough to make them reconsider the drug's risks and benefits. This the families can't understand.
They can't see how any benefit from this drug, a drug in a class of drugs where there are alternatives, would be sufficient to put yourself at risk of liver failure.
My sincere sympathies to anyone who has had an adverse reaction to a drug. However, you must be aware that there is no drug in this marketplace that doesn't have side effects. Some of them can be extremely serious, and some of them can eventually, unfortunately, result in death. But the benefits of that product for that patient and for the disease they are suffering from outweigh the risks. In May of this year, with the data we had from the 12 years of marketing in this country, we, with our experts, came to the decision that the benefits were now outweighed by the risks, on the basis of 4 more cases of hepatic failure which were reported to us from the National Liver Transplant Unit, and on the cumulative data of the 12 years of marketing this product in Ireland led to our decision.
But it's difficult to reconcile this explanation with the fact that in 2003 they signed a statement saying that the risks of the drug outweighed its benefits and that the licence to sell it across Europe should be revoked. Others say the IMB could have taken action sooner.
Once the Irish Medicine Board had huge concerns about this drug, they should have withdrawn it as soon as possible, because one of the things about this medication is that there are other alternatives to it. I mean, we're getting on fine without it since this happened. So they could have pulled it pretty quickly.
Now, having finally and publicly declared that the drug was unsafe in May of this year, the IMB had to make its case to the European regulator so that we could withdraw the drug permanently. The IMB asked one of the UK's top liver medicine experts from Newcastle to present the Irish case in Europe a few months ago. He says the matter is clear-cut.
So why take a drug that doubles your risk of getting liver failure? Even if your risk is still quite small. I would take that small risk if this drug was the only drug that did this and it was the best, and I would take it, of course I would. But I wouldn't take it if there's lots of others and they've got a lower risk of liver failure. Liver failure is rare. Liver failure is rare, full stop. But, you know, when you get it, you die. Or you end up with someone else's liver inside you with a long-term chance of dying from other causes. So it's a small absolute risk of something that's catastrophic. That's the problem.
He thought the decision on whether to withdraw the drug was based on politics as opposed to science. Even countries that didn't have the drug on the market had a vote.
There was only 1 or 2 countries who really had an interest in this and had read the literature, and to a person, the ones that had got involved in this all voted against it. So my impression was that the people that voted for it were those who were sort of disinterested, or, you know, it seemed to be going with other countries that were nearby them, or it didn't strike me as being particularly scientific.